Hi, I'm Dr. Zachary Boucher. I'm a board-certified general surgeon specializing in robotic simple and complex hernia repair. I operate out of Lakeland Regional Health, and I'm the founder of the Florida Hernia Center. Having performed thousands of robotic hernia surgeries, this is my passion. Welcome to Hernia Hub, where we discuss all things hernia.
And today's episode of Hernia Hub, it's going to be me answering questions I get from patients about which hernias need surgery, meaning do all hernias need surgery, which ones can be safely observed. We're going to be talking about both ventral or abdominal wall hernias as well as inguinal groin hernias. And so we'll start off with the first question, which is, I have a groin hernia that pops out sometimes. It bothers me to look at, but it's not terribly bothersome to me. I don't have much pain with it, but I'm worried about having an emergency from it. What are my options? Okay, so this is actually a pretty common question I get for groin hernias especially, and one of the reasons for that is because groin hernias are just so common. In men, 1 in 4 to 1 in 5 guys get groin hernias, so it's a super common thing to happen. There was a big study out of the VA hospital years ago that looked at asymptomatic or minimally symptomatic groin hernias in generally older men. It was from ages like 40 to 65. And then it followed those patients out for 10 to 15 years and looked at which of those patients ultimately had an emergency related to the hernia, and also which patients ultimately ever had surgery for that hernia. And the good news is that very infrequently that hernia led to an emergency. And when we talk about hernia emergencies, we basically are just talking about intestine going through the hole, getting twisted around, becoming a bowel obstruction or a bowel blockage. And so that study showed that this happens around 1 to 2% of the time. Like lifetime risk of having an emergency related to your groin hernia, 1 to 2%, which is pretty low, I think. And so essentially it showed us that there's a 99 to 98% chance that that hernia can be observed safely over time. Caveat is that these patients were asymptomatic, meaning like it didn't bother them that much, not having increasing pain, not having any obstructive symptoms. And obstructive symptoms basically means if you're throwing up, if the hernia is popping out and you have to reduce it, meaning like lay down to push it back in, if you go to the ER to have it push it back in, that is not this patient population for this study. This is patients who had a hernia and they only saw it and it didn't bother them at all otherwise. And so the other part of that study, which of those patients ultimately flipped over to the symptomatic arm, meaning it started bothering them enough to want surgery, that was pretty high, something like 80 to 85% of the time. So as like a Spark Notes version of all that, when I have a guy who comes to see me for a groin hernia, I'm telling them, if this doesn't bother you that much, it can be observed. So the chance of becoming an emergency, pretty low. But if they're like 95 years old, they probably won't ever need surgery. If they're not symptomatic by then, they're not going to be. But if they're a young person, I tell them, listen, you don't need the surgery now. You're probably going to at some point in your life. It's only going to get more symptomatic over time. You could get lucky and you could stay the same forever. And you could be, 20 years old, get a hernia, and then it doesn't bother your whole life. That's just extremely unlikely. So I tell those kind of people, like, you probably will need it fixed in your lifetime. So please tell me if it's getting more symptomatic or you notice it getting larger, because it's easier to fix the smaller hernias than the big hernias. And then we can fix it at that time. So long story short, it's safe to watch unless you're having significant symptoms or it's affecting your ability to live the life from day to day that you want to live. Like if you're a weightlifter and it hurts your groin every time you lift, then it's time to get it fixed. All right, good question. Next one. Are there any hernias that never need surgery? I would say that has more to do with the patient than the hernia itself, meaning if you're a very high risk for anesthesia, so you're like 95 years old, bad heart, bad lungs, in general couldn't tolerate anesthesia, you're probably not going to have that hernia fixed unless it's a super threat to your life, meaning it's one of those hernias that are very high risk to have a blockage or an obstruction. And so that's more of we want to do the best thing for you in your life. We don't want to just fix the things that could be fixed. We want to do the thing that's going to give you the best quality of life for whatever time you have left. And so for a young person who's healthy, most of the time that means just fix it. It'll make your life better. Just fix that thing that's bothering you and could get worse in the future. But for older, high-risk people, sometimes that means the best thing for you is not to fix it. So yes, there are some hernias that don't need to be fixed, but it has more to do with the patient than it has to do with the hernia itself, if that makes sense. Okay, this is a good one. What signs mean it's time to stop watching and schedule surgery? So I always phrase this as, if you've been to the ER for this hernia before, it's probably just time to fix it. Like if it popped out so much that it scared you to the point where like this hurts so bad I'm going to go to the ER, especially if when you're in the ER, they have to give you some sedation medicine to push that hernia back in, which we call reducing the hernia, I would say fix it. Gets a little more complicated if it's, a hernia that's come back, like a recurrence, and you have to kind of plan the repair a little bit. But in general, if you've been to the ER for it, or if it's affecting your ability to live the life you want to live, we kind of talked about that earlier. Like, if you like walking around the block and you can't finish that walk because it hurts so bad, fix it. If it's just cosmetically unappealing to the point where you're self-conscious when you wear a thin t-shirt and you can see it through it, in my mind, that's a good reason to fix it. A lot of people ask me, like, hey, this isn't bothering me, but like cosmetically, I don't like that you can see it through my clothing, or my pants don't fit right and stuff. Will insurance still cover my surgery? And my answer to that is always, yeah. I mean, your insurance companies cover hernia repairs. What insurance company does not cover is rectus diastasis plication, which we can talk about later. Meaning just like your ab muscles separate, but there's no hole in the tendon. Insurance companies don't believe in that. And essentially, if you have a hernia with diastasis, I think it's right to fix the diastasis at the same time. I'm probably in the minority of surgeons who do that. I just think it's the right thing to do. Otherwise, if you don't have a hernia with your diastasis, you do need a plastic surgeon to fix that, and that's a you pay for it situation, which in general in the United States, anywhere from like $8,000 to $15,000 is kind of a median range for that kind of operation. Can a groin hernia heal on its own? No. And there's going to be some some controversy about this, because I've heard some people say, especially like online forums, say I had a hernia and it went away without surgery. In my opinion, like, I'm not there, and it's really hard to comment on situations where I don't know the person, do an exam, but you overwhelmingly likely did not have a hernia at all, right? Like, you probably had a lymph node that got inflamed, got bigger, and then went away. You had a soft tissue injury with a hematoma that went away. Hernias don't go away on their own. Like, that hole in your tendon never heals on its own. It only either stays the same size or gets bigger over time. So the short answer to that question is no. Hernias never heal on their own. Is there a size where the inguinal hernias automatically need surgery? Yes and no. I would say that when they get bigger, they in general get more symptomatic. I very rarely have a guy or girl come to clinic and say, like, I've got this really big groin hernia. Doesn't bother me at all. Like, almost everyone hates that. From your pants fit weird, hurts, the intestine goes in and out, so the intestine's really close to your skin, so you hear that gurgling of the fluid going through your intestine, and just kind of freaks people out. So I would say no, there's no hard and fast rule, except sometimes when you have a groin hernia so large, it extends down into the scrotum, which makes sense, right? Like, the path that the testicle takes through our groin canal to go into our scrotum is what ultimately leads to a groin hernia. And it makes sense that your body follows the path of least resistance. So as soon as that hernia starts getting larger and larger, the intestine slips into that space and goes into the scrotum, which we in the surgical world call a scrotal hernia. And those can get pretty large because the scrotum has an incredible capacity to just get bigger and bigger, and the scrotum can reach, I've seen hernias to the knees. Like, your scrotum stretches all that amount. When they get that big, it's tricky to fix. So in general, if I do see intestine in the scrotum in a hernia, I say it's time to fix it. And again, that's a recommendation. If you've had it for 15 years, doesn't bother you, then sure. But my recommendation would be, if it starts going to the scrotum, then it's time to fix it. All right, got some ventral or abdominal wall hernia questions now. I have a small belly button hernia. Do those always need surgery? No. I think I've had some videos about this where an outie belly button is a small umbilical hernia, right? A lot of people walk around with outie belly buttons, don't need surgery. In general, if your hole in your belly button, like your umbilical hernia, size from side to side of that hole is less than 2 centimeters, your chance of having a intestinal blockage from that is extremely small. And so for the umbilical hernia is kind of similar to the groin hernia, where I say if it bothers you, fix it. If you notice it's getting bigger, fix it. Otherwise, if you just know it's there and your doctor said, hey, you got a hernia, just go talk to a hernia surgeon and check it out, you certainly do not need that fix. But again, insurance does cover them whenever it bothers you to the point of fixing it. But I would say the same criteria for the umbilical hernias as the groin hernias. Can a ventral hernia turn into an emergency? Yeah, and I would say that the numbers for that are pretty similar to groin hernias, somewhere in the 1% to 4% lifelong range. And it's really hard making sweeping generalizations about percentages in ventral hernias, because there can be such a wide variety of ventral hernias. So when we say ventral just means the part of your abdominal wall that's in the front. So that's excluding like flank, or like some hernias like rarely in the lumbar back area, but like ventral hernias are basically any hernia except for the groin. And so they can be in multiple different locations, in multiple different spots. They can be from previous surgery, they can be small, they can be large, they can be recurrent, meaning they've come back after previous surgeries. And the variety of like size of these hernias can be significantly different, where the technique to fix them, there's 15 different robotic ways to fix ventral hernias. There really is just one way to fix groin hernias, maybe two, depending how you define it. But like the variability in ventral hernia types and ways to fix it are very broad. And so I would say that that kind of factors into if there's like a ventral hernia that needs to be fixed or not. In general, I would say the same criteria though. If you're having obstructive symptoms, if it's affecting your ability to live the life you want to live, and if you notice it getting bigger over time. And the getting bigger over time thing is the exact same reason for the groin ones. It's much easier to fix a 2 centimeter ventral hernia than a 20 centimeter ventral hernia. The recurrence rate, meaning chance that it comes back lifelong, is much higher if you let it get much bigger. That kind of ties into this next question. If I choose to have surgery, is there a benefit to doing it sooner rather than later? I would say in general, yeah, and for two reasons. One, it's easier to fix smaller holes than bigger holes for reasons we talked about from like a technical aspects of the surgery. It's easier for the recurrence rates. I mean, chance the hernia comes back again is lower for smaller hernias than for bigger hernias. We think, the literature is pretty split, or variable rather, about like the really large hernias that need sort of like component separations to fix. They can be as high as a 20 to 30% recurrence rate, depending on which study you look at. And so the chance of that coming back for a smaller hernia is much, much lower, probably in like the 3 to 5% range. And so it matters a lot if you let it get too big. But I mean, it's not going to happen overnight, right? The hernia doesn't go from like 2 centimeters to 20 centimeters in, a few months. It happens over years and years and years. That's why I always tell people come to me with asymptomatic hernias, and after we talk about it, we decide just to watch it. Call me if it's getting bigger, and then we can schedule you in the next month or so. It's nothing you need to like rush about. If you see it getting a little bit bigger, you have a long time until it gets to the point where it's going to be a huge problem most of the time. Oh, it's a good one. Does coughing or lifting make a hernia worse? This is a good one. So anything that chronically increases your intra-abdominal pressure can make the forces pushing on your hernia greater, therefore making the chance your hernia gets bigger more likely. Coughing and constipation are the two biggest ones that are modifiable risk factors, right? So avoiding constipation, super important. Most of the time it's from dehydration. Constipation in the United States could also be from just like colonic anatomy. You have poor colonic motility. You really got to shoot for 1 to 2 soft bowel movements a day, however you want to do that, whether it's staying really well hydrated, taking a gentle stool softener like a Miralax, taking more aggressive stool softener like a magnesium citrate. You want to be having 1 to 2 soft bowel movements a day. Otherwise, you're kind of setting yourself up for really straining when you're going to the bathroom, and over time, that puts a lot of pressure on your abdominal wall. The second thing about coughing and such, and it's a little less modifiable depending on like the reason. Like if you smoke cigarettes and you cough from that, like yes, that's something you could stop doing, and then your hernia risk would be lower. The other one that people like talking about is like I have a job where I have to lift heavy, or I enjoy lifting weights. Those things are tricky to me to answer. I in general think and tell people that you should continue to stay active and keep your core strong. So meaning like I have a hernia but I want to keep working out. I say great, keep doing that. That's probably very good for your abdominal musculature, because the tissue around that hernia gets stronger and kind of stabilizes that defect and keeps it from getting bigger. The caveat, this is my opinion, there's no medical literature suggesting this. There's also no medical literature saying this is wrong. It's not a studied thing. It probably never will be. If you just think about like how you construct that study, we're going to take like 1,000 people with a similar size hernia, and then 500 of them work out and 500 of them don't, and see which ones the hernia gets bigger or worse in. Realistically, it's not a study that's ever going to happen. So it's going to have to trust the opinion of whatever surgeon you're talking to, but that's mine. I think you should keep your abdominal wall healthy and strong. A lot of this happens before you have a hernia, right? So if your abdominal wall is strong, and it's not like something like you see bodybuilders with umbilical hernias, like it happens, but part of that too is like natural anatomy. Like that hole where your umbilical cord came into your umbilical area, like your belly button skin, that everyone has a hole when you're a baby, and that closes after your umbilical cord falls off. But for some people, that hole doesn't close fully, and over the time of over the stress of life, the forces like pushing out on that get bigger and bigger and bigger, and your hernia can get bigger over time. But really, it's nothing that I would worry about you know, fixing that hernia if it doesn't bother you. Same thing with umbilical hernias, but I still would recommend keeping your core strong in general. We'll do one more question. Does having had prior surgery change whether a ventral hernia needs to be repaired? Okay, this is a good one. It's kind of tricky. So if you've had a hernia surgery before, hernia was fixed, and then 2 years later it comes back, does that make you more likely to need another repair? No, not really. Unless if there's intestine in that hernia, in that ventral hernia, and I'm talking about ventrals in this scenario, I think it's time to. I think you should fix it. If you have an asymptomatic fat-containing recurrence after a ventral hernia repair, I think that's fine to watch. When you talk about recurrences, it means the next surgery usually is going to be a little trickier, meaning there's probably going to be mesh in a plane, there's going to be more inflammation. In general, that hole, when you close a hole, when it pops back open, it usually doesn't pop back open the same size, usually pops back open a little bit bigger by and large, because those sutures where you put them through the tendon, usually the tendon tears at the level of the sutures, not at the level where the hernia used to be, so usually the hernia comes back bigger. So in general, patients want them repaired when they come back again because, one, they had it fixed the first time for a reason. So you would think that when it came back, they would want it, fixed again because it bothered them before, it probably bothers them now. And it usually comes back bigger. There's usually mesh in a bad spot. Usually I recommend repairing those. But again, if it's totally asymptomatic and doesn't contain intestine, then I think it's fine to watch. I think we'll cut it off there. And I'll see you next time on Hernia Hub.